posture is just stuck and glued, and it's so hard to set up.
No.
It's so hard to move sometimes because you just feel icky and tight all over, or you worked out really good or well, and everything just feels like, oh, I can't move because I'm just so stuck. Or I've got this achy pain here, and I just can't get that movement. It feels like just glue. Earlier we saw this sway in his low back, and he has described some low back pain. So what we first saw was that he had this shoulder tightness that is affecting his ability to play some sports and causing some shoulder pain. But he also mentioned, oh yeah, I actually do have this. I notice I have this sway back, and I know that I have some low back pain, especially when I do those overhead presses all the time. So what I'm going to do here is really try to address his inability to move in this low back area. So what I want you to do for me here is just going to draw in and kind of make a cat, okay? If you want to make cat noises while you go for it. And then go ahead and cow for me. Good. And then come back up and then back down, okay? Good. Now I want you to sit onto your heels. Keep your hands where they are. In yoga, we call this a child's pose, where you just kind of sit back and stretch. We see all this movement here because he is so tight down here. So I can just move these cups into some different places as I go, or I can line up many cups as I go. And right now I'm doing what we'll call a myofascial chain that is a cross pattern. So latissimus dorsi comes down and attaches right on the pelvis, and those gluteus maximus muscles come up and they cross. So as I treat here, I'm addressing this X kind of across his back, which is why I'm kind of doing this cross pattern here. And I get a lot of questions about different types of cups as well. So, for example, in some areas, these silicone cups stick way better. Like, this is a little bit of a bigger cup, and I can cover a larger area. I can also grab hold of that and glide it around a little bit, but I really can't control how much pressure I have going on in there. Whereas these here, I can control just how much pressure I really want. I can increase it or decrease it as I go. So I can use any combination of those, and a lot of people ask, what's the difference? Well, these are kind of easy to use. You can just put them on. They work easy on contoured areas because they're silicone. These are nice because they're lightweight. They stick on. Well, I could have them do some exercises. I could probably have them do some overhead squats, some snatches while having them on, and they won't fall off. Again, I can't control pressure there. The glass cups, they fall off right away. They're so heavy, and I have to have a flame in order to light them and be able to get them to stick to the surface. And again, I'm kind of following his latissimus dorsi here. I'm going to have you place your hands there, open, and then go ahead and rock back up to your hands and knees, and then go ahead and go back again. Okay, so again, we're adding some movement to our myofascial decompression. So we create now lengthening through those glutes, through the lats. Get over to the lats just a hair more there. As we go back and forth, I can then create a little bit more space. Give me that arm. I'm going to have you thread the needle and just kind of stretch here. So he's having some trouble with some thoracic rotation. I can have him add that child's pose, add that stretch a little bit more, bringing him into a little bit deeper of a stretch. Go ahead and come back, and you're going to unthread that needle, lift that arm up into the air. And now remember, he had that trouble folding earlier. Ooh, got a little cavitation there, a little pop, because he's starting to move. So we're going to create some folding where these lats are able to activate and come back, and then go ahead and go back to your hands and knees. Go ahead and take a nap in your child's pose and take some breaths there. So again, we see these red marks on there. They are going to last for probably 2 to 4 days. We're gonna just do some soft tissue work on there to help flush out that congestion or ground substance that comes to the surface and creates the motion there. We're gonna follow up with doing this other side as well, otherwise he wasn't as imbalanced, but if he did have quite a big of an imbalance, I might only do one side or the other, but I wanna even him out and be able to do both sides.